These houses are inadequate.
A study on housing conditions in 4 isolated First Nations communities found consistent respiratory illnesses in children under the age of 3 due to poor indoor air quality. Researchers analyzed factors affecting respiratory health in 4 First Nations communities in the Sioux Lookout region in northern Ontario. High levels of mold in interior surfaces, high levels of endotoxin, a residue of certain bacteria usually associated with wheezing was found. Dr. Tom Kavesi, pediatric respirologist and physician at Ottawa's Children's Hospital of Eastern Ontario, was the lead researcher on the project. He says the study showcases extremely poor living conditions.
These are really small, crowded houses. The average occupancy in these little houses was 6.6 people per house. And these houses had significant amounts of damage.
The study took about 5 years of planning and compiled data between 2019 and 2020 and included homes where 98 First Nations children aged 3 years or younger lived. It found 85% of homes lacked proper ventilation, 44% showed water penetration in exterior walls, more than half had damaged windows, and 6% of the houses had immediate danger. The study also showed nearly 40% of the children suffered wheezing and colds, which is a symptom of asthma. 21% of the children had been admitted to hospital during the first 2 years of their lives, and a quarter of them were medically evacuated due to respiratory illness.
So it gives a real reflection of just how much respiratory morbidity these kids were experiencing.
Daryl Schwader, youth advocate in Shamattawa First Nation in Manitoba, says this isn't a new issue.
There's not a lot of ventilation that's installed in these houses when they're built. Most of them don't even have ventilation. Because of that, there's been a lot of respiratory issues amongst kids.
Christopher Harper, cultural coordinator with Peguis Child Family Services in Manitoba, says these poor living conditions are detrimental to these young kids.
A lot of common colds and flu symptoms, and a lot of people overlook that, and they look at it as an illness and not something that could be hurting them in the future and essentially taking their life.
Anishinaabe Nation Grand Chief Derek Fox in Thunder Bay, Ontario, is calling on the federal government to take immediate action to this crisis. Quote, "We've been advocating for years for substantial improvements to housing, but the government keeps asking for proof that the moldy, drafty houses many of our members are forced to live in are connected to their poor health. This dedicated team has confirmed this link." Dr. Kovesi says it's important the government look at these findings and take these numbers seriously.
We need more houses. We need them as soon as possible. And we need funding to improve maintenance so that these houses can be safe and can stay for a lot longer.
In Winnipeg, Alex Karpa, City News.